I'm Philip Berent, MD, and I'm here to speak a little bit about myself and what services I provide. And to begin, I would say that why did I become a psychiatrist? When I was 12, I decided I would be a doctor. As I read more and more, I had a particular affinity for psychology and psychiatry. And I remember that when I was 17, I was reading Freud's interpretation of dreams. Found it utterly fascinating, and also William James's classic book, The Varieties of Religious Experience. My first year of psychiatric training was at Rush Presbyterian St. Luke's Hospital, which is now Rush University. And during that rotation, it was an inpatient adult and adolescent psychiatry unit. I was gifted by having many wonderful teachers. These people were incredibly well trained. The experience was very rich. It was very exciting. And as I went through my training, and during this time, there was a big movement called the biopsychosocial spiritual approach. Now, of course, the spiritual part didn't really come in until later, but the faith that people have and the beliefs that they have are absolutely critical in helping people recover from any disorder. People need faith, they need hope, and this is what I try to encourage in my patients. And I came to realize that as we had more and more advances in psychiatry, that there were very few hopeless patients. And as I put in my webpage, the person reading this is probably not one of them. In order to make this assessment, I follow what was called the biopsychosocial spiritual approach. Now, this was a notion that seemed to come about with Dr. George Engel in the 1950s. And he was essentially an internal medicine doctor. And he said that the comprehensive understanding of any person needs to encompass all of these facets. There's a very interesting curmudgeonly psychologist called Arnold Lazarus. And he also brought forth that these are multiple dimensions that need to be considered in the treatment of any person. This is what I do. And in order to do that, this requires a sufficient amount of time. So what I do, though, is I would help the person to tell their story. And in telling their story, we gather a lot of information. I view the information that I obtain through this biopsychosocial, spiritual set of lenses, if you will, which provide a clarity to all of these dimensions that is currently lacking in the present practice day of psychiatry. Most of my patients get better. And I ask myself, why don't patients get better when they see other doctors? This is the tragedy of psychiatry today. The advances in neuroscience, in brain science, the advances in the availability of medications have given psychiatrists a tremendous range of options that we didn't even have 10 or 15 years ago.